Pigmentation, or the production of pigment, is the skin's fourth line of skin barrier defense. So it is a defense mechanism to protect the integrity of the skin. Yes, it's annoying. No, we do not want it. And that's what this video is all about. Hello souls, my name is Kathleen and I'm the owner and lead therapist here at Soul Awaken Skin Therapies, my little skin clinic based in South Australia in the little beach town suburb of Glenelg. And here in my clinic, I specialize in treating the skin condition acne from both a scientific evidence-based approach, a corneotherapeutic approach, and a holistic point of view. This channel is all about the skin condition acne, so I can help you to overcome and heal from this really damaging skin condition. So if you're wanting to learn more, definitely consider subscribing, pressing the like button if you like this video, and of course, ring the little bell icon. That means you'll get notified whenever I create a new video. So in today's video, I'm going to be talking about acne scars, and more specifically talking about post-inflammatory hyperpigmentation. You know, those little dark marks that are left over after a pimple? Yeah, those annoying things. I'm going to be talking to you about what they are and how to treat them from, of course, a skincare perspective, a treatment perspective, and a lifestyle and wellness approach. But before we get into today's video, I'd like to say hello and welcome back to all returning clients, followers, and subscribers, and of course, a welcome if you're new. If you haven't already, make sure to go follow me over on Facebook and Instagram. I'll leave my tag just here and in the description box below. I jump onto those platforms to share information spontaneously, sometimes on live videos, and a lot of posts all about skin, not only tips about acne, but around caring for your skin so you can have the happiest, healthiest skin possible. And of course, if you do have questions throughout this video, make sure to pop them in the comment section below. Alrighty, so what are acne scars and what is post-inflammatory hyperpigmentation? Well, first of all, I want to say that there are different types of acne scars. And in this video, I'm going to be talking about the one I just mentioned, post-inflammatory hyperpigmentation. I'm going to break this one down for you. So post meaning afterwards, inflammatory, so inflammation, hyper meaning up or more of, pigmentation, so that is a production of melanin in the skin. So when your skin is creating pigment through the activation of the melanocytes, which then disperse these little melanosomes into your skin cells, or more specifically your keratinocytes, and they're creating a darkening on the skin. This darkening on the skin can be abnormal and it can be normal. A normal example of pigmentation is a suntan. So you've gone out, you've had a bit of exposure to the sun, you've had this activation of the melanocytes, and they've dispersed all their little pigment cells into your skin, and that's created an overall coverage of pigment. However, an abnormal amount of pigment is when it comes up in a way that it is a patch of skin, or in specific to this video, it comes up after a mark has developed on the skin, or an injury or a trauma. So let's go back to the start. So basically it is an injury or a trauma to the skin after inflammation creating hyperpigmentation, so darkening of pigment on the skin. When you break it down like this, it really does make sense, because what your skin is doing is actually trying to protect itself. So what happens, there's an injury or trauma to the skin, so that could be a cut, an abrasion, a sunburn, or even a pimple where there's inflammation that's present, and then the skin, what it's trying to do is go, all right, let's defend our skin, let's protect it, because pigmentation, or the production of pigment, is the skin's fourth line of skin barrier defense. So it is a defense mechanism to protect the integrity of the skin. Yes, it's annoying. No, we do not want it. And that's what this video is all about. So whenever you get a pimple, you will most likely develop a little bit of post post-inflammatory hyperpigmentation. To save time in this video and avoid having to say that word over and over again, I'm just going to refer to post-inflammatory hyperpigmentation as acne scars or dark spots from here on in. Now you know what these dark marks are, we should go into explaining exactly how they manifest on the skin. So depending on your cultural or genetic background will depend on how these marks display on your skin. So for someone with a lighter skin, you will experience them as pink or red or even purplish marks depending on your skin tone. But if you have a darker skin type, they might come up as dark brown, purplish, or even a little bit blackish. So it really depends on where you are on the Fitzpatrick skin scale. I'm going to pop it just here for your reference, but if you do want to look into this more, there's so many different references. I'm going to put a reference down below from dermnet.nz, and you can read up about it there, and you can define which Fitzpatrick skin type you are. But essentially, no matter who you are, what race or culture or whatever, you're still going to get this whenever you have an injury or trauma to the skin. So how do we deal with these dark spots in the first place? Well, the first thing you want to be doing is actually making sure to reduce the thing that is creating the problem in the first place. So in the case of acne, we need to reduce and stop the active acne. So basically we need to break the acne cycle, slow down those pimples so that we're not constantly chasing our tail. So if we go straight into treating these dark marks on the skin, we're really shooting ourselves in the foot because we're going to continue to create more of them. So the first thing is we want to calm down the active acne. Now this video isn't about treating acne and how to heal from acne. I have other videos on that and I'll link them up here and down in the description. But essentially, you want to get that under control. You then want to start to treat these dark marks. And we can do this from a skin care perspective, a skin treatment perspective, and a lifestyle and wellness perspective. So to begin, I'm going to start off with skincare. So what you want to be doing is making sure that you have a few key different types of ingredients to treat this melanocyte activity in the skin. We want to make sure we're suppressing the melanocyte. It's creating these little pigment cells and depositing them into your skin, creating a dark mark. First of all, you want to make sure that you're wearing sunscreen on a daily basis. This is a little bit of a no-brainer, of course, but I need to reiterate this because this is the most important part of treating this. Because if you're not wearing sunscreen, or if you're not applying it properly, or not wearing enough of it, you're really going to slow down this entire process. The good thing is about these dark marks is that they do rectify themselves over time if A, the skin is healthy, and B, we've got everything in a row. So all the ducks in a row and we're giving the skin the things it needs. So if you want to make this a quick and easy process, what you want to be doing is using sunscreen. It's so important. So apply it in the morning, reapply throughout the day. Make sure you're using enough because the amount you use on your skin really determines the SPF factor. And of course, if you can, while you're undergoing treatment to reduce this, please just wear a hat, stay out the sun as much as possible. So now that you've got your sunscreen down pat, make sure you have an acne safe one so it's not breaking you out consistently. You've got that out of the way. You're wearing your sunscreen. It's a habit. Done. We can move on to the next step. So if you are still experiencing a few little spots here and there, so you've really slowed down acne, but you want to make sure to treat the little ones that keep coming up because this is pretty normal. You know, no one's immune to not having pimples. If you've had acne before, you're more prone to them. So you might have a few spots coming up here and there, and you want to make sure that you're actually treating them. And the cool thing here is that most of the ingredients that we use to treat acne are also ingredients to treat these dark spots in the skin. So one of the main ingredients that I love to use on my client's skin is vitamin B3, or more specifically niacinamide. So niacinamide is going to help to reduce the inflammation. It's going to help in a very specific way because it is a tyrosinase inhibitor. Without going into the entire enzymatic process that's kind of happening here, what I'm just going to say is what a tyrosinase inhibitor does is it basically stops pigment in its track. Well, it doesn't stop it, it just minimizes the amount that pigment is being produced. Just consider this analogy. Basically, it's like putting up security cameras around your house, having a big high fence, having some warning signs, and even having some pretty scary dogs around your property. All of those things are going to prevent someone from breaking into your house and stealing things inside, but it's not going to stop it altogether. That's kind of how you can think of a tyrosinase inhibitor. It does inhibit the melanogenesis process, which basically means pigment producing in the skin. So vitamin B3 is excellent for this, and it's also a really good ingredient to treat acne as well, because it's reducing inflammation and it's helping with sebum suppression. So it has many different benefits. It's an ingredient that you will see every single time whenever I'm creating a prescription for my acne clients. So for my next tip, you really want to make sure that you're, one, treating the inflammation and making sure there's really low inflammation in the skin, and number two, you're treating your skin barrier and making sure it's not impaired. Now these two really do go hand in hand, because remember how I said before, this condition, these little dark spots, are related to a post-inflammatory event. So we want to make sure that the skin barrier is nice and strong, because when your skin barrier is not strong and it's not functioning well and it's impaired, inflammation is going to occur. So you really want to get this under control. All of my acne skin clients go through a process, or more so phases, of clearing acne. The first one is the repair phase, which is including the repairing of the impaired skin barrier. Number two, which is the clearing phase, where we're actually really starting to make an impact on the active acne. And number three, the refining phase, where we're actually starting to clear up these dark marks and refining the skin texture. So if you've come to see me, we've already looked after this and we're now in the refining phase. And now that we're in this refining phase, we're going to start adding in different types of ingredients. Another ingredient that we'll want to incorporate into your skincare regime is the use of enzymes and peeling agents. Now, as a corneotherapist, I believe in always maintaining the integrity of the skin barrier, because when we do that, it's at its healthiest and it's actually repairing itself. So when I'm saying enzymes and peeling agents, I'm not saying strip your skin and really, make it peel and fall off. I'm going to actually reference a video down below for you to go check out. It's a video by Beauty Insider, and they had the girl actually go into a skin clinic, I think it's somewhere in America, and she had a peel, and she really goes through the whole process and shows you how it didn't really help her skin. Now, peels and chemical peels do work for a lot of people in the right circumstances. It's just not the way I go about it. So what I do instead is I love to lean on enzymes. Enzymes are fantastic because they never compromise a skin barrier. Well, it really depends on the formulation, but the ones that I use here in the clinic really don't impair the skin, and they're fantastic because what you want to do is very gently and very ever so slightly start to remove those skin cells at the top of the skin. So starting to remove those redundant and old skin cells from the stratum corneum without compromising the skin barrier. So in my clinic, this might look like fortnightly enzyme treatments or even take-home DIY enzyme treatments as well. So the main point here is that you need to incorporate some sort of peeling agent to actually remove off those skin cells, because what's actually happening is that within your epidermis, so your top layer of your skin, where all the melanosomes are actually being pigmented in those little keratinocytes, you actually want to encourage this cell turnover. And as these top cells slough off and enter into the atmosphere that actually left your skin, that's actually the pigment leaving your skin as well. So we want to gently encourage this cell turnover without compromising the barrier, because when you do compromise the barrier, you're increasing inflammation. You're actually increasing your chances of having more pigment on the skin. And that's because pigment actually has a huge inflammation component. I think I'll have to get into that in a separate video. Let me know if you'd like me to talk about that one. And lastly, in terms of skincare, you want to make sure that you're incorporating some sort of collagen induction therapy. So what collagen induction therapy is, it's using a needle to stimulate collagen into the skin. And when we use these little devices, whether it be an at-home device or you go in to get a professional skin treatment, I'll talk to you a little bit more about that in a moment, it's actually going to release growth factors into the skin, and it's actually going to help lighten the pigment by normalizing skin function. So essentially, if you are not coming in for professional skin treatment, treatments, treating acne scars and dark spots using an at-home skin needling device is an absolute must, because it's going to speed up the entire process, create growth factors in your skin, which can't be created any other way. So moving on to professional skin treatments. I just teased on it before, but you want to come in for collagen induction therapy. So first of all, yes, it does induce collagen in the skin. So you're definitely going to get an effect on terms of aging. And I use a machine here in my clinic called the Exceed device by Amy Ahmed. Now, I'm so happy to say that this device is the only device at this moment in time that is actually clinically proven, and I can actually say it according to the TGA here in Australia, that it actually is clinically proven to treat, of course, fine lines and wrinkles, but it's also clinically proven to treat acne scars. So we definitely do have the clinical evidence to support the use of collagen induction therapy, aka skin needling as you might know it. You want to make sure that the therapist you're working with is highly trained and skilled, and they understand the difference between an epidermal skin needling response and a dermal skin response, because different depths in the skin of using this little needle device will really determine your outcome. It's very, very tolerable. A lot of my clients actually feel like it's just a little bit of a tickle. There's little to no downtime, and it's nothing like getting a chemical peel. Most of my clients go back to their normal daily routine on the first or second day. Of course, avoiding the sun and being really gentle with their skin at the same time. So skin needling really is the mainstay treatment for treating acne scars or these dark marks on the skin. You can do other things, and like I said, chemical peels is an option, but as a corneotherapist, it isn't my first preference. So moving on to lifestyle recommendations. This is going to be short, sharp, and shiny. And of course, you've guessed it, avoid the sun. It's really important. Of course, get your vitamin D, make sure you're healthy and happy. Just make sure to reduce the amount of sun, because what that sun's going to do is stimulate more pigment, or at least keep it there for a longer time. You also want to make sure to reduce your stress response. I don't know if you've heard about this before, but your stress is creating inflammation in your body. If you're living in a stressed way and you're constantly creating the hormone cortisol in your body because you're in the fight, flight, or freeze response, or most commonly known as the F3 response, your body is going to be producing more inflammation, which isn't really conducive to healing the skin condition. You can do everything you can to get yourself into that beautiful parasympathetic nervous system, aka the rest and digest state. You're going to be doing not only your skin a favor, but your entire well-being. Get good quality sleep. This is so important because your skin regenerates when you sleep. The better sleep you have, the better mental cognition, the less stress you're going to have. It all works in, everything is connected, so make sure you're sleeping. Also, you want to make sure you're eating lots of good omega-3s. I'll definitely do a separate video on omega-3s and why they're helpful for acne. Actually, you can check out one of my last videos where I spoke about fix these 3 things to heal your acne, because one of the main aggravating factors of acne is a really thickened sebum, and coincidentally, omega-3s help to thin out the sebum. So not only do they do this for acne, but they actually help to maintain a strong, healthy skin barrier. So like I said before at the start, you want to reduce inflammation through making sure your skin barrier is nice and strong. So eat lots of omega-3 rich foods, or take a supplement if you're needing to. One that is very close to my heart, because I am someone that is so prone to this, is skin picking and popping your pimples. My goodness. I can't help myself, and I know so many of you really can't, but there are so many of you as well that I know you're really good at it and you just leave your pimples. But if you can, don't pick your skin, don't pop the pimples. You'll just create more inflammation and make the whole treatment phase a little bit more difficult. And lastly, just have to be patient. This isn't an overnight fix, and the clients that have success with treating this, they're the ones who are patient. They do the work every single day. They follow all of the health and wellness advice, as well as sticking to a skincare regime and coming in for professional skin treatments. So just be super patient. I promise you, post-inflammatory hyperpigmentation is absolutely treatable. you're not going to be left over with marks afterwards. It will go away. It's a skin condition that when I see it in clinic, I feel really happy about, because I can tell that client, look, we can treat this, it will go away. Unlike the other types of acne scars, which actually can leave dents in the skin, which sometimes can't fully rectify. So the good thing is, if you have a whole heap of these dark marks in the skin, you can treat them and they will go away. You'll come back, you'll have healthy, glowing skin, and it will be like you never had acne in the first place. To prove this, I'm going to pop up a photo just here of one of my beautiful clients. She went through the entire acne healing process here at Soul Awaken Skin Therapies. She had a lot of post-inflammatory hyperpigmentation. She was so worried that she was going to have scars for the rest of her life. You look at her skin now, you can't even tell that she had acne. It's incredible. So really one of those lovely, inspiring stories, and there are so many of them. So please let this photo inspire you and just let you know that this is treatable. This is not your future. You can have healthy, glowing skin that you are so proud of, and you can feel really confident in the world. So you can go out there, live your best life, achieve the things that you've always wanted to do, and not have your skin holding you back. And on that note, thank you so much for being here, souls. I hope you've learned something today. If you have any more questions, pop them down below. I'm so happy to answer them for you, and I'll see you here next week. Bye.